Good afternoon. My name is Dr. Ritchie, Elspeth Cameron Ritchie, former retired Colonel Ritchie, and I'd like to spend a couple minutes today talking about the psychological effects of this long war that we've been in and what the provider can do to assist the service member, the soldier, and their families to reduce some of the negative psychological effects of combat.
What has the military done to help people with mental health issues?
The military has done a tremendous amount to try to improve access to care for soldiers and other service members. They have increased the number of providers in the system. They are doing cutting-edge research in surveillance and new therapies. But I'll tell you, the military is doing everything it can, and that's not enough. There's more that needs to be done, both by the VA, and the VA is also doing everything it can, but also by the civilian community. And by the civilian community, I mean academic institutions, I mean public mental health, I mean the private practitioner. Everybody's got to try to do what they can to reach out to the soldier and help take care of him or her.
What about stigma?
Stigma is a continual problem, and there's a lot of talk about eliminating stigma, but I think until we change some of the policies that hurt service members who do go for treatment, it's going to be very hard to actually change stigma. The military can talk all at once about the importance of getting help, and there's some very nice public service announcements that are out there, but if a service member is penalized by getting treatment, they're not going to go for treatment.
What about risk factors for suicide?
The risk factors for suicide for the Army and the other services are very different than the civilian world. In the Army, people who kill themselves, usually it's a combination of relationship problems and work problems. It's seldom psychiatric disorders in the same way it is in the civilian world. So in the civilian world, it's depression, it's bipolar disorder, sometimes schizophrenia. Usually for the Army person, he or she has been doing very well until they have a humiliating event, such as getting in trouble or, again, a breakup with a loved one. And the easy availability of firearms in too many cases contributes to this impulsive suicide. Another thing that is so important for providers to ask about is pain and injury, and if the soldier can't do what they used to be able to do. It may sound silly to a civilian, but for a soldier, they need to be able to hang in with their troops on the run. They need to be able to hump the rucksack for 12 miles. And if they can't do that, then they feel less of a soldier. So it's really important for the civilian provider to be asking about those areas and make sure that the soldier is comfortable that they can continue to soldier.